Hello, my name is Grace Kim, and I'm here to present our work, Analysis of Telehealth Use by New York State Medicaid Beneficiaries in Response to State Policy Changes Pre- and Post-COVID. A disclaimer that the presentation does not reflect the official policy or position of the New York State Department of Health. This project is supported by the AHRQ and the Robert Wood Johnson Foundation, and made possible by the support and faculty at NYU Wagner, NYU Langone, the Health Evaluation and Analytics Lab, and collaborators. Telehealth has the potential to improve value in healthcare by reducing barriers and improving access to care, particularly for those patients with limited access to healthcare services. The COVID-19 pandemic and associated shelter-in-place orders have accelerated the adoption of telehealth. Telehealth has played an instrumental role in maintaining care for low-income populations serviced by the Medicaid programs. The objective of our study is to analyze telehealth claims before and after the COVID-19 pandemic and assess factors that contributed to uptake by Medicaid providers and beneficiaries in New York State. As an overview, there were a number of telehealth coverage and reimbursement policies that were enacted between 2016 and 2020. In January 2016, the state implemented telehealth parity. This policy restricted telehealth use to eligible originating sites, which included facilities only, select provider types, and mandated coverage for telehealth services equivalent to in-person services. Reimbursement was not specified. In 2019, there was an amendment to the New York State Public Health Law, which expanded eligible originating sites to include patients' homes and included remote monitoring to telehealth services covered, and specified reimbursement at a minimum of the Medicaid fee-for-service rates. And then in March 2020, there was an executive order for the COVID-19 state of emergency. Eligible distance sites were expanded to include practitioners' homes. All Medicaid provider types were eligible. There was the addition of telephonic services, and telephonic services were reimbursed. This table shows the reimbursement for telephone calls under the Medicare program in calendar year 2020 for New York City, as well as in the New York State Medicaid program and the fee-for-service rate specified for the telephonic services. The telephonic services are distinguished based on the number of minutes and duration of the call. Our data comes from the New York State Medicaid Data Warehouse and was accessed to identify telehealth claims and assess utilization by providers and patients. The telehealth services identified were based on the New York State Medicaid billing guidance, including the appropriate procedure codes, place of service code, and/or modifier codes. Telehealth eligible services were identified based on a list provided by the Center for Medicare and Medicaid Services. This shows the trends in telehealth services between 2018 and 2020. The top line shows the number of telehealth eligible services over a 3-year time period by month. The orange line on the bottom represents the trend of all telehealth services identified by procedure codes, modifier codes, and place of service codes. As you can see, there was a steep and exponential increase in 2020, primarily due to the COVID-19 pandemic. Prior to the pandemic, there was a slow but steady increase in telehealth claims. And this chart shows the trend in telehealth claims by type, including synchronous audiovisual services, telephone services, and asynchronous services. We find that there was a gradual but significant increase in telehealth services billed in 2019 compared to 2018. Telehealth claims increased by over 90% over this 2-year time period. The total of 70,910 claims billed in 2019 compared to 36,000 in 2018. The increase was driven primarily by a 2-fold increase in billed claims for synchronous audiovisual telehealth services. Telehealth claims still represented a small percentage of total telehealth eligible claims billed to the Medicaid program. This figure shows the trend in telehealth claims in calendar year 2020. The number of telehealth claims represented a 219-fold increase compared to calendar year 2019. and represented 23% of telehealth eligible claims billed to the Medicaid program. Telehealth claims reached a peak of 2 million in April 2020 and decreased to 1.4 million in November 2020. Thank you and happy to take any questions.